Well, welcome. My name is Katie and I work at the Sacramento Public Library where books are just the beginning. October is Health Literacy Month and we will be featuring programs throughout the month to help get you connected with trustworthy health resources and to learn ways to care for you and your family. Today, we are happy to offer you Health Screenings, What You Need to Know, presented by HealthNet. Before we get started, I wanted to mention a few things. If you'd like to ask a question at any point during the presentation, you can feel free to use the chat function, which you'll find at the bottom of your screen. I'll be monitoring the chat throughout the program. Also, if you're having any audio related issues, please exit the program and re-enter. Typically, we find that this will solve the problem. And if you need closed captioning, please click the live transcript button at the bottom of your screen. Also, this program is being recorded and will be uploaded to our YouTube channel, which is under Sacramento Public Library, and it'll be available within the week, so you can look for it there. And finally, I'm going to be sending an email to all participants following today's program with links to any resources that are mentioned or handouts that are mentioned. So let's go ahead and get started. With us today is Martha Garrity from HealthNet. Thank you so much for being with us today, Martha, and for providing this helpful information. Please feel free to take it away.
Okay, thank you, Katie and the Sacramento Public Library for inviting us to partner on this very important program. We've been very pleased and honored to share information to the general public and the community about a variety of health topics, including heart disease, caring for the caregiver, fit families for life, nutrition and physical activity, speaking with your doctor, and navigating the healthcare world in Sacramento. So today we're going to talk about the importance of preventive health screenings. During COVID, we know that many people stayed inside, as was directed by the state and by the governor and the local officials. However, many people were very hesitant to go to take advantage of their provider visits. Consequently, we know that many people may not have been taking care of their self-care or having preventive health screenings completed that were necessary, for example, our children to get into school, for immunizations, diabetes control, chronic disease, medication adherence, etc. So this program is about preventive health screenings at all stages of life. I'm with HealthNet. I'm a health program manager. I represent Northern California, and my area of expertise is chronic disease prevention, as well as a variety of topics. I also work for California Health and Wellness, which is our rural north and our southern counties of California. And the rural north is Sacramento up to Oregon and Sacramento to Tahoe and some of the mountain regions. So I hope you enjoy this presentation. Okay. So today we're going to talk about preventive health screenings for our members and our community at all stages of life. This is a publication that HealthNet provided to our community, and if you're interested in receiving it or getting more information on detailed guidelines, you can visit www.healthnet.com or call one of our numbers below. Education information line, which is 800-804-6074, and information request health education materials related to preventive health screenings and taking care of your health. So we'll go to the next slide. HealthNet is a health organization. We're a health plan, meaning we serve our Medi-Cal members and commercial and also Medicare members. So we cover all lines of business within our health plan. So first I want to talk about the importance of immunizations. Now, we all know we've been faced with COVID recently, and we've needed to get COVID testing often, and also COVID shots. We encourage everyone to get their COVID vaccines. It's very important for community health, and it's very important for you as an individual to protect you and your family. But there are some vaccines that are very, very important, and this is a list of them and a schedule from birth until adolescence. And basically, many of the shots that we are required to have as infants are very, very important for getting into kindergarten, because you must be up to date with your shots. Your child must be up to date with their shots if they're to go to kindergarten. So this is a list of all the shots that are required for children and babies at birth, and then at certain stages of life during the first year and then thereafter. It's very important. We know that many of these vaccines can prevent many serious diseases such as pneumonia, polio, which was a disease that wiped out our country in the early 1900s. Influenza, measles, which is a very, very serious disease for children and can put you at very high risk. So the chart that you're looking at is the schedule of shots required for persons aged 0 through 5. Now, you know that there are about 16 shots required in the first year of life. And you can talk to your doctor about those shots. You can talk to your doctor about the risks involved with those shots, but know that your child, to go to kindergarten after age 6, needs to have his shots up to date. Okay, the next slide. So then we're going to look at vaccines that are required 7 to 18. Now, first of all, tetanus is one that's very important. If your child should slip on a lumber that has a nail in it, your child can get very infected by the incision of the nail to the skin. So tetanus is very, very important to get by age 11, 1 dose, and then catch up as needed. We know that the times between 11 and age 18, our children are at risk for sexually transmitted diseases. They're also at risk because they are involved in high school and in junior high, where there's a lot of peer pressure to maybe engage in activities that you as a parent may not be interested in, but that the youth of our today society are. So it's very important to get some of the vaccines that are required for sexually transmitted diseases. And those usually are given between 11 and 18, age 11 to 18. Hepatitis, measles, again, is the catch up if needed. So if you've had your measles shot when you were a baby or during the ages of 0 to 5, 0 months to 5 years, then you don't need another measles shot. Influenza is flu shot is required, is recommended once a year. And the reason we have flu shots once a year is because we have what we call a flu season. And that is where many of the people in the community are maybe carriers, and the flu is very contagious. So that is a very, very important shot to get each year. And then meningitis is another one. And usually by 11 or 12, you want to have a meningitis shot. Okay, go down a little bit more, please. So catch up if needed means if let's say when you were a child or a baby, your parents did not immunize you, or you came from another country and you weren't immunized, you can get catched up on some of these vaccines. Now, what's important to know is if you are getting your child, say, into kindergarten, you need to have a vaccine record, and you need to prove that you have all the vaccines for your child before going to school. But there is that opportunity to catch up, and you speak with your provider about that. Okay, the next slide. So now we're going to talk about screening tests. And so I want to address the birth, first of all, birth to 6 months of age It is always important at birth to take your baby in after giving birth and have your baby checked for a variety of visits from age at birth, and then every 3 months until at 19 months of age, and then every 6 months, and then every year thereafter after age 3. Lead testing is very important because lead testing, many of our homes and many of our appliances may contain lead, and lead can have serious adverse effects on the child or the family member. So starting at 6 months, the lead testing is usually part of the visit with your doctor, and tests at 12 months and 24 months as your doctor suggests. Finally, blood tests. So blood tests are very important, and birth to 6 months, they should happen once between 0 to 2 months. So between the age birth and 2 months, your baby should have a blood test. And then you check at 4 and 12 months and during routine health exams to just make sure everything is fine with the blood. Body mass index should start at age 2. And in our cultures, many cultures say a chubby baby is a healthy baby. We have to look at that because often a chubby baby can become a very chubby toddler and a chubby youth and then a fat adult. And so what we want to look at the body mass is that your child, your baby is progressing in a very healthy way related to weight and the average range of what babies and toddlers should weigh. So that's a very important throughout life screening that should happen. Next slide. And that's really important too during adolescence and early adolescence. And the reason is that in our population, 35% of our adolescents or our youth are overweight or obese. And if they're overweight or obese at that age, chances are they will become overweight or obese if it's not taken care of as they merge into the early adult years. We know that it is more difficult to lose body weight as you get older. Also, overweight and obesity can be a predictor for obtaining or getting diabetes, heart disease early or later in life, and many of the conditions related to self-esteem among our youth. So we've got to really look at the impact that obesity and weight can have on our children and our youth as they grow to adults. Okay. So I talked about tetanus and varicella, but this is for ages 19 to 65. So with tetanus, you want 1 dose of DTaP, then a boost with DTaP every 10 years. So basically you get your dose and then you boost it with every 10 years, you get another shot. The human papillomavirus is a sexually transmitted disease, and it's called HPV. It is very important for our adolescents and at least by 19 to have the HPV test. It really should happen at adolescence because we know our adolescent and before 19, most of our youth might be sexually engaged. So we want to prevent having HPV be in our community, but most importantly, you don't want your child to have that sexually transmitted disease. And if at high risk between 27 and 49, the doctor also suggests that you have the HPV test. And that is if, let's say you are in a relationship, but you are not sure that your partner is being true to you or it's monogamous. Well, you are at risk for HPV because wherever you have been, if you've been with someone sexually and then they're with someone else, it's like you've been with their someone else, okay? So it's very important to get your HPV tests. But talk to your doctor. All of these are recommendations and not considered a doctor's visit just for the educational purposes. Okay, and zoster is and varicella are common more in age 50 to 65 and over. Zoster is used for shingles, okay, and most of our older adults or middle aged adults might be preempted to shingles. So zoster is used for shingles. Measles, again, we talked about that, 1 or 2 doses as your doctor suggests. But if you've had the measles in early childhood or early infancy, talk to your doctor if you need another. Of course, if you've got symptoms of measles, you need to go in to see your doctor and get that checked on. Influenza every year. Very important for the flu season. Now, they may require the COVID tests more frequently. Right now, they're asking that people get 2 doses of the COVID vaccine and then a booster for some populations, which is a 3rd dose. Pneumonia. Pneumonia is very, very common and can be deadly in our older adults. So sometimes an older adult may fall and end up in the hospital and then catch pneumonia and may end up dying as a result of that. So we've got to be very careful to especially vaccinate our older adults with 1 dose at 65 and over of the pneumonia vaccine, the flu vaccine. Usually you can take the flu and the pneumonia at the same time. You can also take the flu and the COVID at the same time, but please talk to your doctor about that if you have any concerns or other conditions. Hepatitis is a very common disease that our community can be afflicted with, and it is very contagious. So in the adult years, they recommend 2 or 3 doses, and you talk with your doctor about that. And then meningococcal vaccine and meningococcal B, that's another one that you need to check with your doctor. So check with your doctor if you feel like you're at high risk for any of these conditions I've talked to, and to see if you need a shot. So the next screening we're going to talk about is recommended health screenings for adults age 19 to 65 and over. We know that as we age, hearing loss can happen, or hearing just can't be as good. So we recommend that by age 40 to 65 and over, you get your hearing checked. This is more common as you get to the 65 and over group. So important to know that. We also know that as we age, our vision can change. So it's very important at age 19 to 39 to get your vision checked every 5 to 10 years. And then at 40 to 60, every 2 to 4 years. And then of course at 65 and over, every 1 to 2 years. And the reason why we do that is for driving, for reading, just so we can be able to read and have the correct recommendations for glasses and contacts and other things based on our sight. The aspirin therapy to prevent heart disease, talk to your doctor about that if you are at risk for heart disease due to family issues, or to you've had a heart attack or anything. You should talk to your doctor. Many people will take 1 aspirin a day, because what it does is it kind of clears your blood a little bit. It makes your blood thinner, and so the blood is running through your body with the aspirin therapy. But important to talk to your doctor. Very important to check your blood pressure. If you have high blood pressure, every 1 to 2 years. I would say every time you go to the pharmacy to get your medication, the pharmacy has a blood pressure cuff usually. Take your blood pressure. Make sure your blood pressure is at the 120/80 and not too high. And if it's too high, check with your doctor, because chances are you could be at risk for high blood pressure, but you could be taking medication. The medication level might not be correct. Body mass, I talked about the importance of really keeping your weight down and regular to your height and weight requirement, and avoiding obesity because of the risk for diabetes, heart disease, within our youth, bullying, self-esteem issues, and within our youth growing into adulthood with the risks that I discussed. Cholesterol screening, from 1939, it says your doctor suggests. So if you're at an increased risk, if you're overweight, obese, diabetic, you'll probably get your cholesterol screened more often. Very important to check every 5 years your cholesterol level, and you can modify your cholesterol level by eating the right foods or eating less of the foods that may contain high cholesterol, which are a lot of the packaged foods, eggs, high saturated butters, fats, that sort of thing. And of course, that's going to help you also prevent heart disease or manage heart disease, as well as keep your weight down. Colorectal cancer screening to check for colorectal cancer. For ages 40 to 49, your doctor may suggest that you get a colorectal cancer screening. And it's important for both men and women to get it, but talk to your doctor about the test and how it's done. Glucose screening to check for blood sugar. So if you are a diabetic, you should be checking your blood sugar every day. You should be eating a healthy diet, a diet that's recommended in terms of portion size and moderating diabetes. But if you don't know if you're diabetic, you should check if you're at high risk. You're at high risk if you're overweight. You're at high risk if your family member, immediate family member, like a mother or a sister, has diabetes. You're at high risk in a lot of situations. So talk to your doctor, get checked. And if your numbers are great. And if they're not, then your doctor will recommend what to do, how often to manage your diabetes, and how often to see him related to your diabetes. HIV, it's recommended that before 65, you at least do one-time screening. And again, this is sexually transmitted disease. It's very deadly, but it can be managed with medications. And the reason is that one-time screening, if you're sexually active and you're with many partners, or if you're with a partner and that partner's been with somebody else, it's very important to get checked often, because it's a highly contagious disease. And if you have it, you can spread it. So we recommend you use protection, condoms to prevent it, but also get checked for if you're at high risk. And dental, our teeth are indicators of if we have other problems in our body, such as heart disease and others. Also, the buildup of plaque and issues related to not taking care of our teeth, such as not brushing and flossing, can be detrimental later on and cause tooth loss and a lot of issues related to dental. One of the most frequent ER visits can be dental related. Someone doesn't have a dentist, they end up in the ER, they need pain medication, and then they're referred to a dentist, and they may need to have some operations or surgeries on their mouth. So dental is very important. The importance of flossing and brushing twice a day. If you're with your child and you're teaching them how to brush their teeth or wash their hands, you could use an hourglass meter, or you can sing a song while they're doing it. So when they're washing their hands, you sing the happy birthday song twice. When they're brushing their teeth, you sing the happy birthday song twice, and you know that they've done a good job. Also important in dental, not to brush your teeth, but also to brush your gums. And hepatitis C and hepatitis B is a screen of high risk, as your doctor suggests. Next slide. Why we emphasize all these screenings and these vaccines is to protect our community. So now we're going to talk about schedule for women. Women, it's very important. We as mothers, we as sisters, we as taking care of our parents, if we're middle-aged, often neglect our health because we're caring for others, or we're caring for our partner, etc. So we really want to be sure as women we take care of our health. One exam that's recommended is the pelvic exam with Pap test to check for cervical cancer. Now, this is a very important test for sexually non-pregnant people starting at age 21 and to screen every 3 years, screen every at age 30. Very important test to have because cervical cancer can be deadly. And so cervical cancer can also cause you a lot of problems with your women's health organs. So cervical cancer tests as recommended. Mammogram to check for breast cancer. We all know breast cancer starts at age 35, but it can start earlier, especially in our young girls. Very important to do self-breast checks all the time, but to know how to do them, talk to your doctor about how to do them, have a training, look at brochures, and then the mammograms usually start around age 40 to 50, and they're every 1 or 2 years as your doctor suggests. And the breast exam by the doctor. So at 19 to 39, this is the opportunity, especially girls 19. I have a daughter who's 22. She didn't want to do it. I said, you have to do it because you have to know how to do it for yourself. So it's very important by 19 to go into your doctor, learn how to examine your breasts, feel for lumps, know what a lump feels like, and then get checked every 1 to 3 years at your annual appointment. And then age 40 to 65 and older every year, because we know that breast cancer is more common at the ages, at the early middle age to older, because breast cancer can grow fast. Self-breast exam, I talked about that. We should be doing that monthly. Our menstruation, chlamydia screening to check for chlamydia. We know that chlamydia is a very, very progressive disease, and it's very prominent in our youth, women and men. But we know that chlamydia can be spread, and it is very common among those that are in junior high and high school. So it's very important that in early adolescence, they get checked for chlamydia if they're sexually active. Again, just like the other sexually transmitted diseases, these diseases are caused by individuals, sex partners, and unprotected sex, or somebody who might be in a partnership that is not monogamous and doesn't know the partners that their partner is with. So chlamydia is an important screening exam. And then bone density. As we age, we do lose bone density. We lose our density in bones. It's called osteoporosis. When you have that, or osteopenia, you're at risk for falling and breaking bones, and that can cause more serious hospital-related issues. So at age 65 or older, for sure, every 2 years, you should have a bone density test, but even sooner if you're at risk. So if you're quite thin and you have a lot of bones, talk to your doctor and say, should I have a bone density test? Because as you age, your bone density can decrease. Okay, the next slide. So the next slide is the health screenings that are recommended for men. So we know that age 40 to 65 and older, a man should have a prostate cancer check. Usually it's in the age 50 range, unless they're having issues around that area. And then we know too that at age 65 or older, once a year, for those age 65 to 75, the men should have an abdominal ultrasound to check for aortic aneurysm, which is the swelling of the blood vessel around the stomach area. And then the self-exam of the penis and testicles should be as your doctor suggests. Again, our youth, they're sexually active and even beyond. And usually if there's a self-exam and then an exam by the doctor, you can diagnose many issues that might be sexually transmitted diseases like warts and herpes and other things. So it's very important to our males and our females get checked for cervical and testicular exams. Next slide. And so, you know, these are guidelines and they may change. It's a recommendation, basically an overview of the preventive health guidelines that will help you stay healthy, protect your partners and yourself, and really take care of your family. And so we wanted to kind of present this as like a head to toe preventive health guidelines. These guidelines are available in print, and you can reach out to your library contact or to HealthNet to get this presentation so that you can take care of your family and take care of yourself and take care of those who you love to prevent future issues and to have a long life. And I think that concludes the presentation. Yes. So thank you for joining, and please call HealthNet if you have any questions. We are a health plan. Again, we cover Medi-Cal, Medicare, and commercial, and it's an insurance plan, but our goal is keeping our members healthy at all stages of life, supporting the community, and encouraging you to live a healthy and long life. Thank you.
All right. Well, thank you so much, Martha. That was really great information. And I'll leave, just a minute in case we do have any questions here. And just a reminder, I will be following up with people who registered for this program with a copy of the slides that Martha just went over, so you can have that really handy guide for the suggested screenings and immunization. So that'll be really helpful to have for you and your family. So thank you again so much for joining us for Health Screenings, What You Need to Know, and a big thank you to Martha and HealthNet for making this happen. To find a library location near you, sign up for a library card, and to see upcoming virtual programs for all ages, just go to www.saclibrary.org. So for Martha, myself, and for the Sacramento Public Library, thank you so much and be well.
Thank you, Katie.
Thank you.